This is the first of more than one hearing as we try to dig in better on these issues. And I really appreciate your comments here and the points you highlight. Senator Scott.
So just to follow up with what Senator Kaine said. So I come from a business background. So my first reaction is, it's not that the business was bad, right? It's that, was the structure of the deal wrong? Was there no accountability? Was there no measurement? Did it never make, and we don't even have a conversation like that. I mean, it's just, it's like we just want to blame somebody, whoever we want to blame. And we ought to, it's not something that should be hard to figure out. And in business, you have the ability, there's all these organizations now that you can compare your costs, all this stuff to somebody else now. I mean, there's all these comparative groups that you can buy into, and I wonder, I've never heard of any part of the federal government, especially the DoD, ever doing that. So, so just going back to Mr. Rourke, so let me ask you a question. So how could when I became governor of Florida back in 2011, we had our Medicaid program. We made it we bid it out, and the benefit of doing it is we knew our cost, and we also could hold somebody accountable for access and quality, right? And outcomes. But you had to put all this measurement in there. So one thing that surprised me, we didn't have any program where somebody could say, okay, so I wasn't responsible for buying after that. If you're talking about breast pumps, I didn't have to buy breast pumps. It was their responsibility to do that. So how does they have a contract with TRICARE, they bid it out, and then the government's responsible for the purchase of equipment?
So, Senator, in this case, when Congress passed the law that enabled breast pumps, I think what happened was that a lot of suppliers, set up websites and so forth, and let military spouses and military members know that this benefit was available to them, but they didn't have the prices on the website, and so then DHA hadn't set up the price ceiling or the price cap, if you will, and so therefore, if there is no price cap in place, then it just goes into this paid as billed category, as I mentioned in my statement.
It was outside of the contract?
Correct. And so the contractor in that case just pays as billed. If there's a cap, then they can only go up to that amount, and I think that is the key point here.
Do they not use any of these group purchasing organizations? Because I mean, there's a bunch of them now. Matter of fact, one of my own companies has the biggest in the country. And I mean, all that stuff, you guarantee the lowest price. They don't do that?
So what we did is the OIG, to try to oversee this particular item, is that we went to look for other benchmarks, like you said. So whether that is other federal health care programs, Medicare, Medicaid, or whether that is retail prices, we were kind of searching for, what would be a reasonable price for these items. However, I think that is the concern and to some degree the frustration with the paid as billed model, which is, there's a competing interest where DHA wants to get the item out to service members in a timely manner. So there's kind of some incentive to do that quickly, but on the other side, we also want to ensure that we get what we paid for and we pay a fair price, and so that achieving that balance is critically important.
So was it, in your report, when you look at DHA overpayments, was it a little bit of money? Was it, so do you have the numbers on how much it is? Are we talking about quite a bit of money?
Correct. So for breast pumps, the total amount that was paid in 2016 was about $28 million, and we calculated that the excessive charges or the overpayments were about $16 million.
So what's the total value of DHA overpayments found by the Inspector General? How much money is for everything? Do you have a total number?
Across the entire health system? I don't have that number, but I mean, I can speak to these examples. But again, I think we highlight these examples as a way of showing that there's much more out there, and that great efficiencies could be achieved across the board if some of these lessons learned are applied across the board.
Thanks.